Disclaimer: efforts have been made to not to infringe with any copyright. If so, it may be brought to our notice for its acknowledgement in future editions. No part of this digital content be reproduced, stored, or distributed in any or by any means either on paper or electronic media unless authorized. Digital content for candidates with speech and hearing disability. Sector: Apparel, Made-ups and Home Furnishing. Subsector: Apparel. Occupation: Embroiderer. Reference ID: PWD AMH Q1001. Version 1.0. NSQF Level 4. Chapter 9: First Aid and CPR. Unit 9.1: First Aid and CPR. Hello friends, welcome to an exciting session on First Aid and CPR. Key learning outcome: apply first aid on an injured person, understand the procedure of doing CPR. First aid. First aid is the assistance given to any person suffering a sudden illness or injury with care provided to preserve life, prevent the condition from worsening and/or promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing CPR while awaiting an ambulance, as well as the complete treatment of minor conditions such as applying a plaster to a cut. There are many situations which may require first aid, and many countries have legislations, regulation, or guidance which specifies a minimum level of first aid provision in certain circumstances. This can include specific training or equipment to be available in the workplace, such as an automated external defibrillators. The provision of specialist first aid cover at public gatherings or mandatory first aid training within schools. While delivering first aid, always remember: prevent deterioration. Act swiftly, deliberately, and confidently. Golden hour: first 60 minutes following an accident. Platinum period: first 15 minutes following an accident. Prevent shock and choking. Stop bleeding. Loosen victim's cloth. Regulate respiratory system. Avoid crowding, overcrowding. Arrange to take victim to safe place, hospital. Attend to emergencies first with ease and without fear. Do not overdo. Remember that a person giving first aid is not a doctor. Splints and aids of torso. A splint is a bandage that immobilizes a broken bone. Sometimes this is done by using rigid objects such as sticks or boards. For some injuries, however, this isn't possible, and the only option is to tie the broken limb to the body. Splints. While a splint is applied, the broken dislocated bone should not be straightened. This may result in further injury and pain. Splint should be applied to the broken, dislocated bone the way it is. When using rigid material, use long pieces to reach the joints that are beyond the broken, dislocated bone. For example, when splitting a forearm, the material should be of adequate length to touch the wrist as well as the elbow. This keeps the splint in place and prevents application of extra pressure on the wound. Always put padding between the rigid material and the body to keep the injured person comfortable. Knots should be tied between the rigid material and the body in mid-air whenever possible. This is to ensure that knots can be untied easily. If this is not possible, the knot should be tied over the rigid material. To splint the forearm, surround the break with rigid material and snugly bandage it to the arm with white cloth strips. A newspaper or magazine curled into a U shape works very well. Splint the wrist in the same way. The entire forearm should be immobilized. To splint the elbow, use enough rigid material to go from the armpit to hand. The entire arm should be immobilized. Do not attempt to straighten or bend the elbow. Splint it in position. To splint the upper leg, use long pieces of rigid material that will reach from the ankle to the armpit. Above the hips, tie long straps around the torso to hold the top of the splint in place. To splint the lower leg, use rigid material long enough to go from the knee to the foot. The foot should be immobilized and unable to turn. Be sure to use lots of padding, especially around the ankle. CPR. Basic Life Supports (BLS) is the level of medical care which is used for victims of life-threatening illness or injuries until they can be given full medical care at a hospital. First aid is as easy as ABC: airway, breathing, and CPR. Cardiopulmonary resuscitation. In any situation, apply the DRSA BCD action plan. DRSABCD stands for danger. Always take the danger to you, bystanders, and then the injured or ill person. Do not put yourself in danger while assisting others. Response. Is the person conscious? Do they respond when you talk to them, touch their hands, or squeeze their shoulder? Send for help. Call ambulance. Airway. Is the person's airway clear? Is the person breathing? If the person is responding and is conscious with a clear airway, assess how you can help them with an injury. If the person is not responding and is unconscious, the airway needs to be checked by opening the mouth and looking inside. If the mouth is clear, tilt the head gently back by lifting their chin and check for breathing. If the mouth is not clear, place the person on the side, open the mouth and clear the blockage, and tilt the head back and check breathing. Breathing. Check for breathing by looking for chest movements up and down. Listen by putting your ear near to their mouth and nose. Feel for breathing by putting your hand on the lower part of their chest. If the person is unconscious but breathing, turn them onto their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing until you hand over to the ambulance officers. CPR, cardiopulmonary resuscitation. If an adult is unconscious and not breathing, make sure they are flat on their back and then place the heel on one hand in the center of their chest and your other hand on the top. Press down firmly and hand embroidery compressing to 1/3 of their chest depth 30 times. Give 2 breaths. To get the breath in, tilt their head back gently by lifting their chin. Pinch their nostrils closed. Place your open mouth firmly over their open mouth and blow firmly into their mouth. Keep going with the 30 compressions and 2 breaths at the speed of approximately 5 repeats in 2 minutes. Until you hand over to the ambulance officers or another trained person, or until the person you are resuscitating responds. Defibrillators. For unconscious adults who are not breathing, an automated external defibrillators AED is applied. An AED is a machine that delivers an electrical shock to cancel any irregular heartbeat. In an effort to get the normal heart beating to re-establish itself, please ensure that a trained person is there to apply the AED. If the person responds to defibrillation, turn them onto their side and tilt their head to maintain their airway. Number 1. Airway. Once you have assessed the patient's level of consciousness, evaluate the patient's airway. Remember, if the patient is alert and talking, the airway is open. For a patient who is unresponsive, make sure that he or she is in spine face up position to effectively evaluate the airway. If the patient is face down, you must roll the patient onto his or her back, taking care not to create or worsen an injury. If the patient is unresponsive and his or her airway is not open, you need to open the airway. Head tilt, chin lift technique can be used to open the airway. Head tilt, chin lift technique. To perform the head tilt, chin lift technique on an adult, press down on the forehead while pulling up on the bony part of the chin with 2 or 3 fingers of the other hand. Tilt the head past a neutral position to open the airway while avoiding hyperextension of the neck. Number 2. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation circulates blood that contains oxygen to the vital organs of a patient in cardiac arrest when the heart and breathing have stopped. It includes chest compressions and ventilations as well as the use of an automated external defibrillators. Compressions. One component of CPR is chest compressions. To ensure optimal patient outcomes, high quality CPR must be performed. You can ensure high quality CPR by providing high quality chest compressions, making sure that the patient is on a firm, flat surface to allow for adequate compression. In a non-healthcare setting, this would typically be on the floor or ground, while in a healthcare setting, this may be on a stretcher or bed. The chest is exposed to ensure proper hand placement and the ability to visualize chest recoil. Hands are correctly positioned with the heel of one hand in the center of the chest on the lower half of sternum with the other hand on top. Most rescuers find that interlacing their fingers makes it easier to provide compressions while keeping the fingers off the chest. Arms are as straight as possible, with the shoulders directly over the hands to promote effective compressions. Locking elbows will help maintain straight arms. Compressions are given at a correct rate of at least 100 per minute to a maximum of 120 per minute. And at the proper depth of at least 2 inches for an adult to promote adequate circulation. The chest must be allowed to fully recoil between each compression to allow blood to flow back into the heart following the compression. For adult co-workers, CPR consists of 30 chest compressions followed by 2 ventilations. Ventilations. Ventilations supply oxygen to a patient who is not breathing. They may be given via several methods including mouth to mouth. Open the airway past a neutral position using the head tilt chin lift technique. Pinch the nose shut and make a complete seal over the patient's mouth with your mouth. Give ventilations by blowing into the patient's mouth. Ventilations should be given one at a time. Take a break between breaths by breaking the seal slightly between ventilations and then taking a breath before resealing over the mouth. Pocket mask. CPR breathing barriers such as pocket mask create a barrier between your mouth and the patient's mouth and nose. This barrier can help to protect you from contact with patient's blood, vomitus, and saliva, and from breathing the air that the patient exhales. Assemble the mask and valve. Open the airway past the neutral position using the head tilt, chin lift technique from the patient's side when alone. Place the mask over the mouth and nose of the patient, starting from the bridge of the nose. Then place the bottom of the mask below the mouth to the chin. The mask should not extend past the chin. Seal the mask by placing the webbing between your index finger and thumb on the top of the mask above. The valve while placing your remaining fingers on the side of the patient's face. With your other hand, the hand closest to the patient's chest. Place your thumb along the base of the mask while placing your bent index finger under the patient's chin, lifting the face into the mask. Performing CPR for an adult. Step 1. Check the scene for immediate danger. Make sure you are not putting yourself in harm's way by administering CPR to someone unconscious. Do whatever is necessary to move yourself and the other person to safety. Step 2. Assess the victim's consciousness. Gently tap his or her shoulder and ask, "Are you okay?" in a loud, clear voice. If he or she responds agreement, "yeah" or such, CPR is not required. Instead, undertake first basic aid and take measures to prevent or treat shock, and assess whether you need to contact emergency services. If the victim does not respond, continue with the following steps. Step 3. Do not check for a pulse. unless you are trained medical professional. Odds are you will spend too much valuable time looking for a pulse when you should be doing compressions. Step 4. Check for breathing. Make sure that the airway is not blocked. If the mouth is closed, press with your thumb and forefinger on both cheeks at the end of the teeth and then look inside. Remove any visible obstacle that is in your reach, but never push your fingers inside too far. Put your ear close to the victim's nose and mouth and listen for slight breathing. If the victim is coughing or breathing normally, do not perform CPR. Step 5. Place the victim on his or her back. Make sure he or she is lying as flat as possible. This will prevent injury while you are doing chest compressions. Tilt their head back by using your palm against their forehead and a push against their chin. Step 6. Place the heel of one hand on the victim's breastbone, 2 fingers width above the meeting area of the lower ribs, exactly in the middle of the chest. Step 7. Place your second hand on top of the first hand, palm downs. Interlock the fingers of the second hand between the first. Step 8. Position your body directly over your hands so that your arms are straight and somewhat rigid. Don't flex the arms to push, but sort of lock your elbows and use the upper body strength to push. Step 9. Perform 30 chest compressions. Press down with both hands directly over the breastbone to perform a compression, which helps the heartbeat. Chest compressions are more critical for correcting abnormal heart rhythms. You should press down by about 2 inches, 5 cm. Step 10. Minimize pauses in chest compression that occur when changing providers or preparing for a shock. Attempt to limit interruptions to less than 10 seconds. Step 11. Make sure the airway is open. Place your hand on the victim's forehead and 2 fingers on their chin and tilt the head back to open the airway. If you suspect a neck injury, pull the jaw forward rather than lifting the chin. If jaw thrust fails to open the airway, do a careful head tilt and chin lift. If there are no signs of life, place a breathing barrier, if available, over the victim's mouth. Step 12. Give 2 rescue breaths, optional, if you are trained in CPR and totally confident. Give 2 rescue breaths after your 30 chest compressions. If you have never done CPR before or you are trained but rusty, stick with only chest compressions. Step 13. Repeat the cycle of 30 chest compressions. If you are also doing rescue breaths, Keep doing a cycle of 30 chest compressions and then 2 rescue breaths. Repeat the 30 compressions and 2 rescue breaths. You should do CPR for 2 minutes, 5 cycles of compressions to breaths, before spend time checking for signs of life. CPR used AED. Step 1. Use an AED automated external defibrillator. If an AED is available in the immediate area, use it as soon as possible to jumpstart the victim's heart. Make sure there are no puddles or standing water in the immediate area. Step 2. Fully expose the victim's chest. Remove any metal necklace or underwire bras. Check for any body piercing or evidence that the victim has a pacemaker or implantable cardioverter defibrillator. Should be indicated by a medical bracelet to avoid shocking too close to those spots. Make sure the chest is absolutely dry and the victim is not in a puddle. Note that if a person has a lot of chest hair, you may need to shave it if possible. Some AED kits come with razors for this purpose. Step 3. Attach the sticky pads with electrodes to the victim's chest. Follow the instructions on the AED for placement. Move the pads at least 1 inch 2.5 cm away from the metal piercing or implanted devices. Make sure no one is touching the person when you apply the shock. Step 4. Press Analyze on AED machine. If a shock is needed for the patient, the machine will notify you. If you do shock the victim, make sure no one is touching him or her. Step 5. Do not remove pads from the victim and remove CPR for another 5 cycles before using the AED again. Stick-on adhesive electrode pads are intended to be left in place. Chain of survival. Chain of survival is a sequential process for providing treatment to victims of SCA outside of a hospital setting. More people can survive SCA if the following steps occur in rapid succession. Cardiac arrest is immediately recognized and the emergency response system is activated. Early cardiopulmonary resuscitation CPR is started with an emphasis on chest compression. Rapid defibrillation occurs. Effective advanced life support is begun. Integrated post-cardiac arrest care is provided. Quick execution of each step is critical because the chances of survival decrease 7 to 10% with each passing time. Thank you.